Mario, your trainer with Lodestone Athletics, and let's get into the topic. How strengthening your hips can fix knee pain. Knee pain is a common complaint amongst athletes and non-athletes alike. While the knee joint itself is often blamed, the root cause of knee pain can frequently be traced to issues with the muscles surrounding the hip. Understanding the relationship between the hips and knees and how strengthening the hips can alleviate knee pain requires a look at the biomechanics of the lower body and the roles different muscles play. The biomechanics of the lower body. The hip and knee joints are part of a kinetic chain that includes the lower back, pelvis, hips, knees, and ankles. These joints and their associated muscles work together to allow for smooth, coordinated movements such as walking, running, jumping, and squatting. When one part of this chain is weak or misaligned, it can cause stress and imbalances in other parts. Hip abductor muscles. The hip abductors, primarily the gluteus medius and minimus, are responsible for moving the leg away from the body's midline and stabilizing the pelvis during activities like walking and running. Weaknesses in these muscles can lead to improper alignment of the knee as the thigh tends to rotate inward, placing additional stress on the knee joint. Hip extensor muscles. The gluteus maximus, one of the primary hip extensors, is crucial for activities that involve pushing the body forward or upward, such as running and jumping. Weaknesses in the gluteus maximus can lead to over-reliance on the quadriceps and hamstrings, which can result in knee pain due to the increased load on the knee joint. Hip flexor muscles. Tight hip flexors such as the iliopsoas can also contribute to knee pain. When the hip flexors are tight, they can alter the pelvis's position and affect the knee's alignment. This can lead to compensatory movements that strain the knee. How hip strengthening helps. Strengthening the hip muscles addresses the root cause of knee pain by ensuring proper alignment and mechanics of the lower body. Here are several ways in which hip strengthening can help alleviate knee pain. Number one is improved alignment. Strong hip muscles help maintain proper alignment of the pelvis and femur, which is the thigh bone. This ensures that the knee tracks correctly over the foot during movement, reducing abnormal stresses on the knee joint. Number two is enhanced stability. The hip muscles, especially the abductors, play a crucial role in stabilizing the pelvis. Improved pelvic stability prevents excessive inward movement of the knee, which is a common cause of knee pain and injuries like patellofemoral pain syndrome. Number three is balanced muscle activation. Strengthening the hip muscles ensures a more balanced activation of the muscles in the lower body. This prevents over-reliance on the quadriceps and reduces the load on the knee joint during activities such as running and jumping. Number four is reduced compensatory movements. By addressing muscle imbalances and weaknesses in the hips, hip strengthening exercises can reduce compensatory movements that place additional stress on the knee. This leads to more efficient and pain-free movement patterns. Hip strengthening exercises. Incorporating hip strengthening exercises into your routine can be an effective way to address and prevent knee pain. Here are some exercises that target the key hip muscles. Number one is going to be clamshells. The target muscles is the gluteus medius and the gluteus minimus. How to perform. Lie on your side with your legs stacked and knees bent at a 90-degree angle. Keeping your feet together, lift your top knee as high as you can without rotating your pelvis. Slowly lower your knee back to the starting position and repeat on both sides. Number two will be the side lying leg raises. Target muscles is the gluteus medius and the gluteus minimus. How to perform. Lie on your side with your legs straight, lift your top leg toward the ceiling, keeping your hips stable and your foot flexed. Lower your leg back down with control, repeat on both sides. Number three is bridges. Target muscles is the gluteus maximus, hamstrings, and lower back. How to perform. Lie on your back with your knees bent and feet flat on the floor. Lift your hips toward the ceiling, squeezing your glutes at the top of the movement. Lower your hips back down with control. Number four will be squats. Target muscles, the gluteus maximus, quadriceps, and hamstrings. How to perform. Stand with your feet shoulder width apart. Lower your body as if you are sitting back into a chair, keeping your chest up and knees aligned over your toes. Push through your heels to return to the starting position. Number five is going to be lateral band walks. Target muscles, the gluteus medius and the gluteus minimus. How to perform. Place a resistance band around your legs just above your knees. Bend your knees slightly and step sideways, maintaining tension in the band. Continue stepping to one side, then switch directions. Number six will be the hip thrust. The target muscles, gluteus maximus, hamstrings, and lower back. How to perform. Sit on the floor with your upper back against a bench and your feet flat on the ground. Place a weight across your hips, lift your hips toward the ceiling, squeezing your glutes at the top. Lower your hips back down with control. Number seven will be the single leg deadlift. The target muscles, the gluteus maximus, hamstrings, and lower back. How to perform. Stand on one leg with a slight bend in the knee, hinge at the hips, and lower your torso toward the floor while lifting the other leg behind you. Return to the starting position and repeat on both sides. Number eight is the fire hydrant. Target muscles, gluteus medius and gluteus minimus. How to perform. Start on all fours with your wrists under your shoulders and knees under your hips. Lift one leg out to the side, keeping your knee bent. Lower your leg back down with control and repeat on the other side. Number 9 will be step ups. The target muscles, gluteus maximus, quadriceps, and hamstrings. How to perform. Stand in front of a step or bench, step up with one foot, pushing through your heel to lift your body. Step down with the same foot and repeat on both sides. Lastly, number 10 is the bird dogs. Target muscles, gluteus maximus, lower back, and core. How to perform. Start on all fours with your wrists under your shoulders and knees under your hips. Extend one arm forward and the opposite leg backwards, keeping your core engaged. Return to the starting position and repeat on both sides. In conclusion, strengthening the hip muscles is a critical component in addressing knee pain. By improving hip strength and stability, you can ensure proper alignment and mechanics of the lower body, reducing stress and strain on the knee joint. Incorporating the hip strengthening exercises listed above into your routine can help alleviate existing knee pain and prevent future issues, allowing for pain-free and efficient movement. I hope you learned something. Stand out, be different.